There are 17 million reported cases of depression in the United States, and only 30% of those patients will ever reach full recovery. If you've ever suffered from major depression or know someone who does, you know how vastly damaging it can be to every aspect of life. Resistant and severe depression does not discriminate. It affects every corner of the world, every culture, and there is a more recently discovered medicine that could be an answer to an affordable, effective treatment for this disorder. New insights have been gained on ketamine's potential antidepressive and anti-suicidal effects. Ketamine is successfully treating psychological disorders and will soon be an amazing universal treatment around the world. I'm going to highlight for you everything that we've discovered about ketamine's other medical uses besides the anti-inflammatory and anesthetic effects. Let's learn more about ketamine's recent and successful uses in treating psychological disorders such as major depression and suicidality, and the benefits of using ketamine as opposed to other more common depression treatments alone. Ketamine is still widely unknown, although there are clinics available to administer the drug all over the world, dozens in the United States, and already one right here in the Treasure Valley. Of the 17 million people in our country who suffer from depression, 11 million of them receive treatment for it in some form or another. Of those 11 million seeking treatment, only 50% will see a temporary reduction in symptoms, and only 30% will reach full recovery. These patients who have resistant depression are the ones typically being administered with ketamine, and the studies have produced some fantastic results. But before we get into the clinical studies, I'd like to teach you about the history of ketamine. According to the National Institute of Health, ketamine's history begins with phencyclidine, which was first synthesized in 1956 by chemists at Park Davis Company, who discovered ketamine's unique and fascinating pharmacology. According to Dr. Domino and Dr. Luby, leading doctors on the first trials, phencyclidine was capable of causing the appearance of drunkenness in rodents, delirium in dogs, and anesthesia in monkeys. Although demonstrated to be a safe and reliable anesthetic in humans, it also caused an intense, prolonged emergence delirium that ultimately made it undesirable for human use. At that time, efforts were subsequently redirected by Dr. Domino towards synthesizing a shorter-acting analog of phencyclidine that would have similar anesthetic potential but cause less emergence delirium. Ketamine, then identified as CI-581, was one such agent developed by Park Davis consultant and organic chemist Calvin Stevens in 1962. A structural analog at 1/10 the potency of its parent drug, phencyclidine, ketamine was subsequently selected for human trials, and the first anesthetic dose was administered on August 3, 1964 by two University of Michigan professors. In their initial pharmacological study of ketamine in 20 humans, the doctors found evidence that the drug could be safe and effective for clinical anesthetic use. In 1966, they published findings from the first clinical experiences with ketamine, reporting its anesthetic effects in 130 patients aged 6 weeks to 86 years, undergoing a total of 133 surgical procedures. They found ketamine could rapidly produce profound analgesia with a unique state of altered consciousness and a limited duration effect that could be safely prolonged with repeated administration. With minimal emergence delirium, Ketelar then became the first preparation of ketamine approved by the FDA, and that was in 1970, approved for human use for the very first time. Imaging of neurons in the brains of living mice reveals how synapses between cells are eliminated in response to stress and reinstated by antidepressant dose of ketamine. The findings, which were presented in Science Today on April 11, 2019, show that while ketamine-induced changes in behavioral perceivedness, the increased connectivity is required to maintain the drug-modified behavior. It's beautiful, very elegant, and technologically sophisticated, says neuroscientist Jason Radley of the University of Iowa, who wasn't involved in the research. I think this paper is going to make a significant contribution, says physiatrist and neuroscientist Alex Kwan of the Yale School of Medicine. Dr. Lisson of Weill Cornell Medicine and colleagues have now followed the course of chronic stress treatment with live animals. The team previously used developed images technique involving the permanent insertion of a tiny prism into the animal's brain to enable visualization under a microscope of deep cells within the cortex. This has allowed for very clear and accurate, undisputable results from these studies. Nicole Bateman is a patient who had battled with depression unsuccessfully for nearly her whole life, trying dozens of antidepressants, attending therapy, and even receiving inpatient treatment in a hospital. About 6 months ago, she learned from her therapist about ketamine, a prescription medication that is approved for use in hospitals and other medical settings and as an anesthetic, and is now gaining a widespread attention for depression. Soon after she began receiving regular infusions of ketamine, Bateman says, the depression began to lift, and I quote, "I feel like a different person. It's as if there were a veil over me and the veil was lifted. Before I started to receive ketamine, I could barely get out of bed. Now I can walk my walk and re-engage in life." End quote. This seems to be the most consistent result I've ever seen in depression treatment. I've experienced in having and dealing with depression, and that's relevant because I've taken many different medications to treat my depression and anxiety. Ketamine is clearly the fastest acting, most consistent, and seems to be less detrimental to your health than using typical depression treatments because of its short acting duration. Recent clinical trials with ketamine and the treatment of major depression have shown some extremely promising results. The drug, typically known for its use in the club scene and use in veterinary settings, is now showing its true colors, and it has many more uses, including great results in the treatment of severe depression and suicidality. "It's as if there was a veil over me and it was lifted," said Nicole Bateman in 2019. This statement is one that has run true for many patients all over the world, thousands of them. Major depression is similar to a large dark cloud or a veil in many ways. It robs millions of people every day from quality of life and happiness within themselves. It's likely that you come into contact with someone every day who is suffering, although you may not take notice. This information and this amazing chemical could be the answer for somebody that you care for. I believe these new studies could lead to a great win for doctors and patients alike. I believe it's time for us as a country to step up and actually start looking to cure ourselves instead of treatment with lengths that are unknown. So many pharmaceutical drugs are made to treat depression, but why would we continue down that path when there's a possible cure? Ketamine should not be looked down upon any longer. It could be our key weapon for battling severe depression on a global scale. Thank you, guys.